go
Yeah.
into the skeletal landmarks somewhat and palpate some of the main things so you can see them. I'm not going to cover everything. The skull is pretty easy. External occipital protuberance is a little notch in the back of the skull. You can feel it really easy back here on the patient. And again, find it on yourself and then find it on another person and try several people because everybody's a little bit different and you'll find that quite a bit. Hyoid bone, it's what you swallow with. It's this right here, very deep in here, and if you'll come up high on your throat and swallow, you'll feel it as you swallow. We don't use it much in physical therapy, but it's on here. Clavicle, right here, and I'm going to go through some of these and maybe have to go back, but the clavicle, you have the medial and the lateral end joint right here is the clavicle and the sternum. SC joint, the AC joint's out here, okay? So if I'm going to find it, I always find the big bony landmarks that you can. So she's got a nice clavicle that really sticks out right here, and what I'm going to do is find that nice bony landmark, and I'm right here on her. I'm going to come in, and right there is that SC joint. If I'm going to find the AC joint, again, I just find that bony landmark and come out right here where the hook is, and that's the chromium and the chromium and clavicular joint. Okay? It's that easy, really. Nice thing about the joints is that they just name the two bones that articulate. So you don't have to make up new names. You know those two bones, you got the name of it. The jugular notch is going to be right here, and this skeleton doesn't have much, but again, you can see it. It's a nice notch right here. The manubrium is going to come down a little bit. The body of the sternum and the sternal angle. The sternal angle is this right here where it comes across that sternum, and this skeleton doesn't show it very well, but the sternum actually sets like this, and that sternal angle is right there. That gives the sternum an angle. And you can feel it's where the second rib runs in, and if you'll feel it, it's right there on her. It's kind of a little bit of a lump. And you can feel it on yourself usually. Find your notch. I'm finding the notch and coming straight down, usually about an inch or two, you'll feel a little bit of a bump. And that is where that sternal angle's at. It's about the second rib. Xiphoid process is clear down here. We don't really palpate that much. It's very tender. You don't want to break that. It's easily broken. But you need to know for the skeleton. If I'd have an arrow pointed for that, that's a xiphoid process. Inferior angle. Wait, stand up. Inferior angle of scapula is right here. You remember what that is? It's upward downward rotation. Remember, that's what we watch. If you go up, it goes out laterally. That's upward rotation. Find the medial border of the scapula. And if I can't find it, sometimes I just kind of, right there it is. I can see it moving up. My finger's right there on it. As she goes up and down, it rotates. My finger's right here. I'm just going to go through this stuff. Medial border of scapula, the medial or vertebral border, which I'm right here. I'm going to go straight up, and there's the spine. The root of the spine is right here, right where the spine comes into the vertebral border, okay? And the spine just runs out, and it comes clear around over here, and it comes around to the chromium process. So if I need to find that, I can poke around here, or I can find the spine and work my way out till I can come clear around. I know I'm right on that chromium process, okay? Let's see what else we have. Okay, we had the medial border, which is the vertebral border. We've got the lateral border or the axillary border. Of course, the axillary means armpit of the arm. So medial, lateral. Infraspinatus fossa. Infra means below spine. So I find the spine, I go right below it. Spine, I go right below it. There's the infraspinatus fossa. Supraspinatus fossa is going to be right above it. Find the spine, I go right above it, and you'll feel a soft, muscly indentation. That's a supraspinatus fossa with the supraspinatus muscle. Okay? Yeah, let's see what else we got. Go ahead and turn it down. On the front, coracoid process. It's right here. You know, it's right medially and below the chromium process. So again, I'm going to find the spine, come around, right there it is, right there's the chromium, so I'm right here, I know it's right, and right there it is. I can feel it. Another way you can feel it is just put your thumb, I don't know how I started doing this, but I put my hand like that, and my thumb will go right there on that. Feel it? It's very tender. Don't push on it too hard. It'll get sore quick. Okay, coracoid, come on, spine. We got the root of the spine. All right, let's going on to the humerus. Head of the humerus, which fits in the glenoid fossa, which is here. It's going to set up like that. With setting out, the biggest bump on the lateral side is the greater tubercle. Then you have the groove, bicipital groove, which the bicipital tendon runs up. And then you got the lesser, okay, tubercle. This is one that gives a lot of people trouble finding. And so I'm looking at her right here, and I'm looking right here for that groove. If she turns in, this would turn in. And you see the groove, especially the lesser tubercle disappears. So if I want you to palpate the lesser tubercle, and you come in, you've got her like this, and you palpate, I'm going to say, no, that ain't right. So you want to make sure anatomical position on that lesser tubercle. Turn out, so she's in anatomical position. Now that groove is looking right at me. That groove's right there. Right there's going to be the lesser, and there's the groove, and there's the greater, okay? But if you got to watch with the arms turned on this one. But if you always turn it out, there's no issue, okay? Let's see what else. We have deltoid tuberosity, which is right here. There's not a good bump on that, but you'll find that's where your 3 deltoid muscles come down and insert right here. I just remember that it's about 1/3 of the way down on the lateral side of the humerus. And if you'll come down, you can usually kind of feel right there's a bit of a bump, and that's where it is. And if you'd tell me that, that's my need to palpate. Lateral, about 1/3 of the way down, it's right in here, we're good. But if I put an arrow right here, then that's what that is. See a little bit of a bump there. I want to keep going down, but I don't know. I want to make sure I cover these. We'll go down through these, and if you have any other questions, you let me know, okay? Medial epicondyle of humerus, lateral epicondyle of humerus. Okay, there's a really easy, again, get back to anatomical, come down to humerus, right there, the first nice big bump. That's the medial, the lateral's on the outside. That's easy. And it starts getting a little more tricky in here. Head of the radius is one that gives a lot of people issues. You want to go digging in here, and you're digging over here. You want to come in on the back, which you're coming right here. You find the lateral epicondyle, which is on right here, okay? So I put my index finger on that lateral epicondyle, okay, which I'm, right now, that's what you want to do. Look at the skeleton and get myself in that position. So right now, I got my finger here. If I put my next finger down, I'm going to be right on the head of that radius. So, okay, there's that. And then I put my finger right down beside it, and there's a little round, kind of a pea-shaped bone. You feel a little like a pea right there. That's the head of the radius. And you can prove that by supinating or pronating. When I supinate and pronate, this one here that I think is the head of the radius will turn. The top one, which is the lateral epicondyle, will not. It's hooked onto my humerus. It's not turning. So as I turn it, right there's my head of my radius. What I'm doing is I'm palpating just like this, and I'm doing that. That tells you that then you're right on it. So I'm going to get, I got to get her just right. I'm going to get on this side. It's hard when you're backwards. There's her lateral epicondyle. Right there's her head of her humerus. Feel it moving? Yeah. So, I mean, it takes some practice. You're not going to get this in a second. So find it on the skeleton and then start finding it around on you. If you've got an issue, then ask us. But if you can't find it, find a good bony landmark right beside it, and you're going to be in good shape. Of course, the lecranon process, that's just the elbow, right? That's nothing easy to find. Radial styloid process, it's right there, it's on the radial side. You want to watch the radial head is up here, right? The ulnar head is down here. Look at it in the book, it's going to be down here. It's backwards. Most heads are, when they stand up, radial head's here, ulnar head's opposite. Be careful with that one, okay? Ulnar styloid process is just that little piece sticking out right there. So you could just find it, and it's a little bit distal, right there at the very edge. But I look on here, if I don't know where it's at, right there it is, so then I just find, okay, my ulna's on this side, right there is that little projection. It's not that hard once you take the time to look it over. Okay. I've got the hand on YouTube, and I went over that pretty good. I don't think I need to go over that again. The spine. Transverse intervertebral foramen. Foramen is just the hole. Foramen means it's a hole. So intervertebral foramen is going to be the hole runs down in through the spine. We can't really get to it. I sure can't palpate it. The discs are just the discs. And I don't guess, you're going to get, just looking. I guess they don't get, you guys don't get the transverse process and all that. I was showing them out there, and in your other pages that Kinsey give you, there's like 6 or 8 pages, and they've got good landmarks on how to find things. The spine, there's one in there you have to memorize and know from now forever. And it talks about the spine and the landmarks to find it. You've got to memorize these and don't forget it. C7 is one of them. If I've got something up here in the skeleton, just come down and find exactly which one it is. If I point to this, you'll find later this is the spinous process. What is it? It's 1, 2, 3, 4, 5, 6, 7. There's C7. T1, 2, 3. That's T3, spinous process. And then you're going to find these are the transverse process. Okay? But on the skeleton, I'm going to walk down, I can number them. On her, it's harder to find. I mean, if I'm down here trying to find something, I'm going to be guessing, truthfully. What we want you to do is to learn the main ones. C7 is the first one. Okay? It's the first big prominence right here. So have her flex her head and see it sticks out right there. See it pop out? That's C7. Got it. Got to palpate C7, have her flex and pop. Put your finger on it. If it's over here, I count the exact vertebrae. Now, the other next level down, I remember the 737 for some reason, like the jet. 7, my next landmark is I want to find T3, and it's going to be the spine. So if I ask you to find the spine, the T3, so I will tell me I got spine of the scapula, I come straight over, there's T3. Good enough. If you need to find T4, find the spine, come over, tell me there's T3, I'm going to go to the next one down, that's T4. Good, you're good to go. It's that easy. 737, the next one is 7 is inferior angle. Now over the inferior angle, we got to know that. So right here is going to be T7. Okay? So I find her inferior angle, come straight over T7. So I got C7, I've got T3, I got T7. The next one you'll have to know is the crest, the
Iliac.
crest of the pelvis, or the ilium. Right here, I've got my hands on her crest, which is right here. Find that, come straight over L4. Some books say L4 or L5. We've got L4. Either one would be fine. Okay? So I need to find L4. I find her crest, come over. There's L4. The next one is S2, which is the PSIS. And we've not gotten down that yet, but it's right here. So the best, this right here is a PSIS, posterior superior iliac spine. Put my hands right on her crest. Right there, I'll feel like two little marbles. That's the PSIS. And if I would do that, and so it's right where their belts are. It's right there. That's going to be S2. That's right where those two dimples are at. You guys see those dimples in a lot of people? Not everybody's got them. That's where the PSIS are at. So right there, I come over, that's S2. So I've got C7, I've got T3, spine, I got T7, inferior angle, I got L4, 5, right at her crest, and I've got S2, PSIS. That takes everything you need to know about palpating the spine here in this 3 semesters before. ASIS. Anterior superior iliac spine, right here. Anterior inferior iliac spine is right there. It's in your book. These will be, could be on the skeleton Monday. If I would put an arrow right there, that's the inferior iliac, inferior, I can't say it, anterior inferior iliac spine. That's a superior, anterior superior iliac spine. I can't palpate that one, but I can find this one. I'm just going to come over, find her crest, and then we'll walk down it right there. We'll walk down. Yeah, she's tickling. Right there it is. So I just take it, you just take it, find that crest, it's easy to find, and walk down it so you get right there. You know, I don't think we'll have to palpate that, truthfully. But you could, but it'd be hard to find. But on the skeleton, you know, it's very easily beyond there. I can put anything on the skeleton. Iliac crest, again, we've been over that. That's right there. That's, what's that landmark? Spine. L4, L5, right? Okay. That's why it takes, but you just got to keep repeating it, keep repeating it. SI joint is right here. If you're really good, you can find it, but you won't probably have to palpate that in here right now. It's pretty tough. You'll learn more about it later, but you need to know where it's at. That's the SI joint. You know it's on both sides if I put an arrow on the back side. All right. Ischial tubes. We just talked about those. Ischial tuberosities right there. That's what you set on. If you're setting, stick your hand underneath your butt and you feel them. If you have to palpate those on somebody, you know, you can do it 2 ways I found to do it. I could say, go ahead and put your finger on where your butt bone's at. And she'd be right there, and I could come in here and palpate it. Or if I had to and she didn't know what she was doing, I would start laterally and go into I felt it. Okay? We don't have you do it very much here, but that would be how you do it without just start grabbing and poking. There's 2 ways you can do it that I think are
Like
not very.
hip flexion, it pops out more.
Yes.
Too.
Yeah. And I would like to really laying down. You can see these better. PSIS are easy to find though. When you're standing up. All right. Okay, let's look at this. Of course, the head, the neck, the surgical neck. This is the neck of the femur, surgical neck of the femur. Greater trochanter is right here. It's the big bump And you'll find you're going to learn it for Bony. It's a lot of landmarks for greater trochanter. The way to find that is to take your hand, put it right on your crest. Put your palm right on your crest, extend your fingers all the way down, and you'll be right on top. I can feel mine. You feel it? You're right on top. Oh, all you've done, if this is right, you put your finger here, see, I'm right on the top. That's an easy way to do it. And then, if you can't, not sure, you can feel it, have them internal, external rotate. And you'll feel that big bump, thump, thump. It'll kind of roll over, you'll feel it. The lesser, we won't palpate, but it could be on the skeleton. Medial and lateral epicondyle, the femur. Medial epicondyle, lateral epicondyle. Again, the femur, it's easy to find. Just come right down. Right there's her lateral. Right there's her medial. Okay? You just, see again, look, I just come straight down this, straight down the femur. If I come here and I come there, and there they are. I'm trying to make sure I've got the right ones here. I'm getting the senior stuff and you guys mixed up. Adductor tubercle. This gives a lot of people a lot of trouble. This little ridge right here, that's the adductor tubercle. A lot of your big adductor muscle, adductor magnus, I think, attaches to that. So to find it, again, look where I'm at. I'm right where the medial epicondyle of the femur is at, and it's just back up a little bit proximal. If I can't find it, I can find that. So that's what I'm going to do. I can feel it sometimes on people, and other people I can't. Find the medial epicondyle. I'm just going to walk back up, and you, right there it is. I'm going to say, right there it is. And I'm good with that. All I've done was find that medial epicondyle and walk back up. Yep, there's the medial. I'm going to come right back up. I'm right on it. Okay? Medial and lateral condyles of tibia. We're just talking about, these are epicondyles. They're above. Epi means above. So you're above. Okay? These are the condyles of the tibia. They're kind of hard to find. They're kind of hard to palpate. I mean, you can come up and you can feel them. And I like to kind of work the knee. Right there they are. I can feel that knee working. I go up here, the femur's not moving, but this tibia is. Find those big bumps, and right here, I know that's them. And that would be good enough, okay? It's the condyle, not the epicondyle. Epicondyle's up here. Tibial tuberosity. See that bump right there on the tibia? That's the tibial tuberosity. Real easy to find. It's right there. Some of your quads come down, all the big quads come down, come across, hook onto that. Easy to find. Head of the fibula. Right here's the fibula, there's the head. Sometimes this is a little bit of a bear to find on some people. And most people want to come to medial, but it's right here. It's a lot more lateral than what you would think usually. See, it's clear over here. Her head of her fibula is right there. And if you feel it on yourself, you'll feel it. It's just a nice little knob. Again, some people stick out. Mine sticks out pretty good. Other people you can't even find hardly. But again, I know where it's at. It's just about even with the tibial tuberosity. So if you got somebody that's got a big leg or something, I found the tibial tuberosity comes straight over. I'm pretty good with that. You know what you're talking about. Okay? Styloid process of fibula, lateral malleolus. Lateral malleolus is here. Styloid process is just a little more distal. A styloid process means it's going to be sticking out, some kind of process. So lateral malleolus is, go ahead and pop your shoe. It's going to be here, just going to be kind of the ankle, and you come down. Process is going to be sticking out a little more. It's not going to be down that far. It's going to be right in there. It's kind of hard to feel, okay, as it Talotibial. This is the talus, this is the tibial. There's the talotibial joint. Again, don't freak out with these joints. It's just the two bones that articulate. I know where talotibial. Okay, I know where the tibia is at. Where's the talus at? The talus is this bone right below it. So you found the joint. You know the bones, you can make the joint. It's harder to find. We won't have you palpate a lot, but you're going to dorsiflex, plantar flex, and it's going to be right here. I can feel that joint, and that would be fine. Okay. Calcaneal tuberosity. It's just the heel. I mean, it's just the heel. Easy. Tuberosity of the fifth. That's fine. Nah. Tuberosity of the fifth. See this? Fifth, which is the fifth tarsal. 1, 2, 3, 4, 5. Tuberosity is that big bump right there. Okay? That's the tuberosity of the fifth. So it's on the lateral side. You can see hers right there sticking. See it? You guys on that side, you can see it? Hers really sticks out right there. It's not up here. People want to go up here. It's back here. As you can see this, clear back. Navicular. Navicular is on the medial side. Navicular is right here. You just got to go in and learn these bones. But the navicular tuberosity is easy to find. There's a navicular bone. There's a tuberosity. Tuberosity is like a process. Process is a lot of times a little more smaller, but they stick out. Tuberosity is going to be a pretty good bump that sticks out. And that's the navicular tuberosity. Very easy to find right there. If you feel it yourself, you can go right there and you should be able to feel it. And navicular tuberosity, again, we've got the cuboid, which is going to be right here. I got navicular, I got the cuboid. Again, how do I find a cuboid? I can't really feel that thing over here, but I see that big bump. That's the tuberosity of the fifth. It's right beside it. It's right distal, proximal. So I find that fifth, I come back just a little bit, there's the cuboid. Again, you find one good landmark, use it to find something else. Navicular, cuboid, subtalar. Talotibial, the subtalar. Subtalar just means tibial talus, so that's the tibial talar joint. Subtalar means below the talus. So it is right here. It's also called the talocalcaneal joint. Okay, two names for it. But it just names the bone. Don't freak out. Just know the names of the bone. Oh, they're talking about that. That's just those two bones, and that's the joint. It's in here. Again, I would just dorsiflex her a little bit and try to find it down here. It's not easy to find, truthfully, but you move around, you'll feel it a little bit. It's pretty rare we'd have you check that. Subtalar is the same as the talocalcaneal joint. There's really not much left, truthfully. Bones of the foot, I think Kenzie's kind of been over these. You just got to learn them. 3 cuneiform, intertarsal bones. Same as the feet, same as the hands, except they're called tarsals instead of carpal. There just isn't any different. And it's easy to find here, except in here we don't have any landmarks to find any other carpal or tarsal bones. If you'll know the 1 through 5 and know the joints, again, the toe, you've got one, you've got an IP joint, and on the rest of the toes, you got a pip and dip, just like you do the fingers. No difference. And what else do we have on here that I missed?
Any lingering questions from anybody?
Any questions on anything? Foramen means holes. I think there was a cervical foramen.
The transverse foramen.
Yeah, and that's only in the, you can't
Upper,
palpate them.
yeah.
It's only in the cervical. And it's right here. These are the cervical foramen. If you'll look the very top right here, these are called transverse processes stick out on your cervical you've got little holes framing for the nerves to go up to the skull. That's all they are. There's none down here. That does cause some issues. Is there anything on the lower we missed? Magnum foramen here, sciatic notch. I don't think we get into that yet, though.
I
I
don't
think
think
we
that's
did.
on our list.
Huh?
I think you got it.
Is it what we got? We have that on the.
No, I think you got everything.
Yeah, okay. I think that is.